Okay, let's continue talking about hypnosis. So last week, basically what we did is we went through some theories of hypnosis, right? And there's one theory of hypnosis I want to consider that I didn't talk about, which is, are people just faking it? Are they just putting it on? Because we would need to take that seriously as a theory and discard it before we continued, because if that was true, there's not really a lot of interest in pursuing hypnosis any further. So by way of doing that, this lecture, what I want to do is go over some of the basic facts to do with hypnosis. So we know what are the phenomena to be explained. What is it that we need to get a handle on in terms of thinking about conscious and unconscious processes. So I'll introduce some methodology, consider in what way are hypnotic behaviours involuntary, and part of that will be considering whether they're just faked or not, so in which case they're completely volitional. And then consider alterations in perception, in other words hallucinations, and the evidence concerning them and the conditions under which they occur, and the extent to which we might in some sense consider them real, before asking questions about altered states of consciousness, which hypnosis raises. So hypnosis raises issues to do with response to suggestion, but also whether there's some global change in consciousness that is required or facilitates the response to hypnotic suggestion. So I want to bring up issues of altered state. Then all of that together will then set the stage of the basic phenomena that we need to explain, and next lecture I'll give you my explanation of all of that. An important piece of methodology which we turn to now, methodology, is the real simulating design of Martin Orne. And this is an obvious way of getting at the question of, is there a difference between simulating or faking hypnotic response and real hypnotic response? So Orne was a psychiatrist who used hypnosis as part of his therapy. He thought it was real, but he wanted to come up with a way of showing it was real, or what was real about it, or how much of it was real, whether there was an essence of hypnosis above and beyond what people might just put on, as it were. So the idea is that you take some highly hypnotizable people, call them the reals, give them some tasks to do, some suggestions, and compare them to simulators, who are people asked to fake being hypnotized. And to make sure that they are faking it, Orne argued we need to use low hypnotizable people for the simulators, because if you used highly hypnotizable people, they might drift into hypnosis, and the behaviours you get are really hypnosis. So the simulators are those who are asked to fake. And to make this as convincing as possible, what happens is one experimenter selects the subjects. The subjects have been screened on some scale, like we use here. 10% at the bottom of the scale are the lows. And the first experimenter says, you're going to meet a hypnotist, a second experimenter soon. He doesn't know whether you're a real or not. You've got to convince this person that you really are responding to the hypnotic suggestions. If he doesn't think you're responding, he'll tap you on the shoulder and ask you to leave. The game's up. And then the first experimenter also recruits some highs and just introduce them to the second experimenter. So now, the hypnotist then doesn't know who's faking and who isn't. And the first surprise for Orne was when he had the experience of being the second experimenter, the hypnotist. He basically couldn't tell who was faking and who was real. He thought he would be able to, and he couldn't. So the first moral to take home from this is it's actually fairly easy to fake hypnotic response, which is perhaps a bit disconcerting. Now, the way Orn analysed this was to say, well, the simulators don't experience hypnosis, but they can work out what's expected of them. And all the cues in the situation that tell the simulators or anybody what they're meant to do are called the demand characteristics. So demand characteristics is a term coined by Orn, specifically in these original papers of his about the real simulator design in hypnosis. But the concept was so useful that it's now just part of psychological jargon. We all talk about demand characteristics in any experiment. But originally it came from the hypnosis research literature. So the simulator's behaviour reflects the demand characteristics. That's everything about the situation that informs them how they're meant to behave. And part of that will be what the hypnotist says explicitly, your arm will rise in the air, but also any body language or subtle cues, tone of voice, micro reactions, little pauses or whatever, in terms of how the hypnotist reacts to the subject, will be giving the subject cues about how they're meant to behave. But also part of demand characteristics will be general cultural knowledge, the things you think you know about hypnosis anyway, that you take on board in terms of deciding what's required of you and responding to the situation. Now, the real's behaviour, in other words, the highly hypnotisable people, that will respond to demand characteristics because all humans respond to demand characteristics. We all like to do what's expected of us. But in addition, there could be other aspects of their behaviour that weren't demanded or suggested per se, but just reflect the essence of hypnosis. So any difference between reals and simulators, Orn argued, reflects the essence of hypnosis. Now, if any given experiment there was no difference between the simulators and the reals, the conclusion isn't that the reals were necessarily faking. That's a possible conclusion, but it's not a necessary conclusion, because, for example, we can fake being angry, we can fake being sad, we can fake lots of things. It doesn't mean that anger doesn't have an essence or isn't real, or sad isn't real, and so on. Just because somebody can fake something doesn't mean there isn't a true version of it. Of course, if over many experiments and many different ways of measuring things, there was never a difference between reals and simulators, the faking hypothesis would gain in credibility. So I introduced that as an important piece of methodology, and the first message from that is it's easy to fake a lot of hypnosis. So let's try and get at this another way, and we'll come back to the real simulator design after this experiment. You could say, well, okay, perhaps a way of testing this is to see if we can make reals do antisocial acts. So if hypnosis is extremely compelling, then we could make somebody do whatever we ask of them. That, after all, is the stereotype of hypnosis. The person's mind becomes handed over to the hypnotist, so the hypnotist can request of them whatever he or she wishes. Well, there's been a lot of uninformative experiments on that topic. Uninformative in the sense it's really hard to do an experiment where the person genuinely believes they're being put in a situation where they're asked to do something antisocial. But here's an example of an experiment that works. One of the very few. This was replicated by Coe. These days it would be very hard to do this sort of experiment because it wouldn't get past most ethics committees. So people were screened for hypnotizability. You take the highs, and the hypnotist says to the highs, I know I went through this long process of 10-15 minutes of inducing hypnosis, but just like I told you, in fact, in the future that can be abbreviated, and in the future whenever I say now you're hypnotized, you'll be hypnotized, and that indeed is common in clinical practice. So then the the hypnotist arranges to meet the subject, to meet each subject individually, makes an individual arrangement to meet them later by the library. And for half the subjects, the following is put as a hypnotic suggestion. He says, now you're hypnotized, and they're told what to do. For the other half of the subjects, this is just put as a plain request. The hypnotist says, I'm just a poor academic, struggling, it's hard to make ends meet. I do drugs for money. I'd like you to help me with this. Here's a bag of, I don't know, some white powder. If you take it to this apartment block, they'll give you an envelope stuffed full of money. You just take that envelope, bring it back to me. Okay, that's the deal. So the question is, what proportion of subjects went through with this, and putting it in as a hypnotic suggestion, did one increase the rate at which people committed what was a crime? Well, 9 subjects went through with the crime, 3 out of 12 from the hypnosis condition, but essentially a very similar proportion in the no hypnosis condition, with no evidence that hypnosis increased the rate at which it happened. And we know this experiment was done well. In other words, the experimenter was a good actor, because one of the subjects almost beat him up. So outraged were they by being asked to do this act. And in another case, the father of the subject phoned up, enraged and wanting something to be done about these horrific activities happening at university. So he put on a good show. Only about a third of the people went through with it. There was plenty of room to see hypnosis push that up, but it didn't to a detectable degree. And indeed, at least on a post hoc interviewing, the subjects who went through with it said, I have no problem with drugs, sure. And those who didn't go through with it said that they had moral issues with drugs. So the conclusion from this is that hypnosis doesn't make you do anything that you really wouldn't do otherwise. If it goes against your principles, you can choose to not follow through with the hypnotic suggestion, even though it feels to you like you're doing it in an involuntary way. And that fits the metaphor that I used at the beginning of the hypnosis session last week with the pendulum. You can make the pendulum feel like it's going round and round and round as if by itself, but you have control over whether you have that experience at all. So hypnosis wouldn't be a great technique to use down a dark alleyway with someone trying to mug you. Yes?
I'm really sorry, the projector isn't on.
Oh, good point.
Sorry.
But now I want to argue the other side of the coin, which is to say that although you cannot compel people to do things that's really against the will or against the principles with hypnosis, at least not to a great extent than you can get with an authority figure anyway. I mean, you probably know the experiments where an authority figure telling you to do something makes people do things more than they wish. That was controlled in the experiment I just talked about, and hypnosis didn't add anything on top of any such effect. But that doesn't mean that subjects were faking. And just as when you were playing with Chevreul's pendulum, there was a genuine experience of involuntariness. It felt as if it was moving by itself. So the experiences of hypnosis could still be real in that sense. In other words, subjects could still have the subjective experience of involuntariness. They may not be faking. So how could we decide that? Well, here's one way of getting at the issue, and I'll consider other methods as we go on with the lecture. So the idea here is, if you're faking, you essentially you fake for an audience, you fake to convince other people. So if you thought you were alone, why would you carry on faking? You wouldn't. So in this experiment by Irving Kirsch, there was reals and simulators, so we're going to use the real simulator paradigm. And a tape play was played, and the subjects thought either they were being watched as the tape player giving the suggestions was played, or they thought they were alone. In fact, they were being surreptitiously observed. Now, did the subjects think they were being observed to see if they were faking or not? Well, one way of telling that is looking at the simulators and looking at experimenter absent versus present condition. So if they thought the experimenters were watching and taking note of them in both conditions, and they're told to put on a good show for the rest of the experiment, then they'll perform the same in these two conditions. But if there is a difference in simulators where it's presented to them as if they're alone, as opposed to when there's experimenter clearly there, then we can say there were different levels of demand created. Now, given we have created different levels of demand, we can see what the reals do. Do they comply with those different levels of demand? Now, in the case of the simulators, out of 10 suggestions, there is a massive difference between the conditions where there's an experimenter present, and that's obvious, and in the case where they thought they were alone. And in fact, this 2.7, the paper reports, is a bit of an overestimate, because what the simulators were doing were sitting there reading magazines, and they might stick out the arm, or arm rising a bit like that in a half-hearted manner, but it technically passed the criterion for moving a few inches, so it counts as passing. So now the question is, we've created a situation where people asked to fake perform extremely differently, whether they think they're being watched or not. What happens to the reals? And the answer is really not a lot at all. The reals put on just as convincing a performance, whether it seems they think they're alone or they think someone is watching them. So it seems unlikely, based on this, that highly hypnotizable people are just faking to put on a show, because even when they apparently think they're alone, they're responding just as fully and convincingly, just absorbed in their performance. Yes.
Could they sort of be faking for themselves? You know what I mean? If they're so convinced that this is what's expected and this is what they're meant to be doing, their arms meant to be going.
So could they be deceiving themselves?
Sort of.
Well, that could be one of the theories. We'll come back to that. That could be a theory of what's happening with hypnosis. It's a case of self-deception. So I'll take that possibility as something interesting to be explained, as a possible theory, in fact, of hypnotic response. So you can see that fakers and apparently reals, highly hypnotizable people, respond very differently on this task. So despite Orn's initial experience of finding simulators and reals can behave very similarly, you can set up situations where they behave very differently. So let's just take that for now as sufficient evidence to go on and say there's something interesting to be explained. And as I say, in the course of considering the phenomena of hypnosis, we'll see examples where it becomes untenable to hold a faking hypothesis. Now I just want to consider a point that illustrates demand characteristics, and hypnosis being real in some way aren't necessarily the contrasting theories that one might expect from Orn's presentation of the phenomenon, where hypnosis being real is somehow additional to demand characteristics. Because what if the extent to which you experienced involuntariness was itself sensitive to demand characteristics. So this is an issue that Stephen J. Lynn looked at. He gave a lecture on hypnosis. And in effect, last week I put you in one of these conditions. So one group of people were told, the resist subjects, in the course of a general lecture about hypnosis, that a good hypnotic subject is actually able to resist a suggestion when requested to try to resist. So that's what I told you. I told you you had the choice, as I was going through the suggestions, at any time you could stop following the suggestions if that suited you, or you could dip back into them if that pleased you. And I said it's just like Chevreul's pendulum, whereby because you're creating the experience of involuntariness, you can decide to stop creating that experience as well. So in effect, I told you that if you decided you wanted to resist, or someone else came along and said, now please resist, you would be able to resist if you so chose. But another group of subjects were told the opposite. They were told a good hypnotic subject is actually not able to resist a suggestion. If someone asked them to try and resist, you just wouldn't be able to do it if you're a good hypnotic subject. So now, this is the information given in the context of a lecture, so it becomes presumably part of the beliefs of the subjects involved, and hence part of the demand characteristics. Subjects were given 5 motor suggestions, and for example, that your arm is light and then is rising, and then asked to resist it. And the degree of movement was rated on a 3-point scale, so 15 would be the maximum movement, and 5 would be the complete resisting. You could stop it without moving at all. Now the two groups, the group that told they were able to resist, essentially resist almost completely and stop almost all motion from happening. But the group told that they wouldn't be able to resist, essentially were unable to resist at all. It's a fairly large and striking effect. So there's a curious tangle here, that the ability to resist depends on your belief of whether you can resist. So the belief that you cannot resist may indeed make it seem to you that like you can't resist, and in a case where it didn't matter that much, make you unable to resist it. But all you need to be able to do is to believe you can resist, and then you could resist. So this makes me wonder about cases, if we go back to the drug experiment. Let's say you're a bit borderline, you're a bit on the edge. Maybe hypnosis could add a bit of persuasive power if you believed you cannot resist hypnotic suggestions. It's not entirely clear to you whether this, how strongly this goes against your principles. Maybe if we could redo these experiments with lots more subjects and deal with issues where the person's a bit more on the borderline, we could find hypnosis adds a bit of persuasion by monkeying with the loops in people's heads, by giving them beliefs that they can't resist, and those beliefs becoming self-fulfilling prophecies. Now, another very important aspect of involuntariness in a hypnotic setting is, and this often comes up in legal settings, is if you give a post-hypnotic suggestion, is the person compelled to carry that out? So for example, let's say I give the suggestion, hypnotize you, then I say, while you're hypnotized, in the future, after I brought you out of hypnosis, and for the next 48 hours, just to be really clear about the time over which the suggestion is meant to apply, and this is what happened in this experiment. In the next 48 hours, whenever you hear the word experiment, your right eye will be itchy and you'll rub it. Now, what will happen when the person hears the word experiment in a completely different context, where there's nothing to do with the hypnosis apparently? Do people just feel a compulsion to respond to the post-hypnotic suggestion, no matter whether it's appropriate to the hypnotic context? Well, simulators, so this was another real simulating design. Simulators are asked to fool everyone connected with the experiment to make sure they understood they are meant to respond to the post-hypnotic suggestion in any context whatsoever that might be connected to the experiment. So now, when the post-hypnotic suggestion was given, and then the hypnotist said, counts them out of hypnosis and says, now that's the end of the experiment, that's the first formal test. Then when they come out, the secretary says to them, can I book you in for 2 days' time for the next experiment? Well, that is a situation not obviously to do with, it's not clear that the post-hypnotic suggestion is meant to work, is meant to apply at that precise moment that the secretary says, can I book you in for the next experiment? But it's still somehow connected with the experiment. And then crucially, over the next 2 days, this was a campus university, Confederate has been given photos of the subjects and accidentally bumps into them and asks the way to Professor Smith's physics experiment. So now there's no obvious connection with the hypnosis at all. It's to do with physics, it's someone else, it's on the campus. What happens? Well, in the initial formal test, where the hypnotist themselves say that's the end of the experiment, all of the reals, 10 out of 10, and all of the simulators respond to the post-hypnotic suggestion in the sense that they rub the eyebrow when the word experiment is given. In the informal test, where the secretary says, can I book you in 2 days' time for the next experiment, then about half of each respond. But in the Confederate, where there's no reason at all to respond in terms of this being part of the hypnosis experiment, none of the reals respond and only one of the simulators does. So hypnotic behaviour is not elicited out of context. In fact, I think this is a really crucial experiment, one I'd like to replicate because it's such an important conclusion about hypnosis. I mentioned legal cases. There have been legal cases where someone has been to see a stage hypnotist, and the claim was that the suggestions given by the stage hypnotist carried on applying after the event was over and in the subsequent days. Well, this experiment indicates that there's nothing about hypnosis per se. There's no compelling power of hypnosis out of context. In other words, hypnotic behaviour is, as a very early researcher called White said around about 1942, he called it goal-directed striving. In other words, when you respond hypnotically, it fits in with your purposes and goals. In that sense, it's very different from schizophrenic hallucinations and any automatisms, in which case the responses, although they look in some sense similar to hypnosis, do not further the goals and agenda of the person with schizophrenia. And arguably there would be some mental disorders, conversion disorders, like when people have, in a fugue state, they have amnesia. These are hypnotic responses being put to use, or when you have conversion, blindness or paralysis and so on. These disorders are related to having high hypnotizability, and they're probably an example of these responses furthering some agenda of the person, perhaps albeit at an unconscious level. Now, just because the behaviours fit in with the person's goals and occur when they're appropriate, that doesn't mean that the subjects are faking. So you might say, well, it fit in with a faking hypothesis, but it doesn't mean it's faking at all. So to go back to your point, this could be a self-deception going on. So you set it up so that things fit what you need, fit your agenda, fit your goals, but nonetheless you still create the experience of involuntariness and compulsiveness in yourself. Just as you could create the experience of the pendulum going round and round because it suited you. So that covers the issues I wanted to talk about in terms of involuntariness. And you see it's a slightly complex topic. On the one hand, we can rule out maximal voluntariness in the sense of faking. And on the other hand, we can rule out maximum involuntariness in the sense of it occurring out of context in the compulsive way, or no matter what your moral principles are. Say, no, it's not like that. It's somewhere in the middle. There appears to be an experience of involuntariness that's somehow under the person's control. So now, hypnosis involves changes in the experience of volition, but also changes in how reality is experienced, changes in perception, hallucinations. So what we'll now go on is to consider hallucinations. A sort of negative hallucination is when you don't experience something that you would normally experience. Blindness would be an example of that. Here I'm going to consider pain. So there might be some noxious stimulus, in other words, some stimulus that causes, or at least potentially causes, damage that the body would normally represent and warn you about by pain. How can we hypnotically change the experience of pain? So this is what I'll consider now. So analgesia means the reduction of pain. There were, you could say, two main theories about what happens, which goes back to the two main theories that we talked about last week. The sociocognitive perspective says, yes, people can hypnotically reduce pain, but that's because people can reduce pain to a very large extent, more than they know, by active strategies you can use outside of a hypnotic context. So there are cognitive behavioural packages, stress inoculation training, for example, that can produce dramatic reductions in pain, just by teaching the person some tricks and how they pay attention, what they think about, what they imagine, what they say to themselves. And hypnosis is just like that. You're just using cognitive strategies to reduce pain. On the other hand, the dissociation theories, like those of Hilgard, you say, no, there's a way that hypnosis reduces pain that is different from manipulating your attention, from using deliberate strategies. There's a special mechanism, say dissociation, that indeed is more powerful than other more mundane methods of pain reduction. And this is an issue that, in fact, we are currently addressing. It sort of came to a stalemate in the 80s. Hilgard said, look, if you use a hypnotic induction, give pain reduction suggestions, you get more reduction in pain than without the hypnotic induction. So the hypnotic version of the suggestion produces more pain reduction. Well, Spanos said, yes, but that's because of the demand characteristics. When you use a within subjects design, in other words, the same subject has both treatments, they understand they are meant to produce greater pain reduction after the hypnotic induction. What else was the point of the hypnotic induction? So there's something called holdback, Spanos said, whereby if they know there's going to be a hypnotic induction condition ahead, they'll hold back their full response when there isn't hypnotic induction. So what you really need to do is a between subjects design where the subject is unaware of any other possible conditions. So in every condition they'll give it their all, and in the between subjects case you get no significant difference between the hypnotic suggestion and the suggestion without hypnotic induction. Well, Hilgard said, but between subjects designs are very insensitive. It's the within subjects designs that are more sensitive. So I stand by what I said. And there was the stalemate, where each side had an explanation for the other's findings, and the situation just stopped there. The reason why I want to revisit that is, and in fact, George will be a PhD student with me next year and started working on this as a master's student, is we now know how to deal with data insensitivity, namely with Bayes. So we can carry running people with the between subjects design, and we know when we'll have enough sensitivity to pick up the sorts of effects that Hilgard obtained with the within subjects design. But one thing one can conclude from all of that was whether hypnotic induction is given or not, and we'll see this, you get massive degrees of pain reduction just by giving us a suggestion. And if the induction does add something, it just adds a little bit. So the argument is really about whether you can add a little bit on top of what is already a big change. And if you could add a little bit by hypnotic induction, is that just because you've increased people's expectations? And expectations are important for hypnotic response? Or is it because you've induced an altered state and people responding in a fundamentally different way? Now, I'm going to go through a paper that argued that cognitive behavioral strategies for dealing with pain are radically different from hypnotic pain reduction. But I want to use their data to argue, actually, maybe they're not that different. So the conclusions, I just want to warn you, the conclusions I take from this paper were not the author's conclusions, but rather the opposite. So what they did, so this is from Kenneth Bauer's lab, who was in the dissociation camp following Hilgard. And so he thought that hypnotic analgesia was a radically different way of reducing pain than you could achieve by strategies of manipulating attention, what you say to yourself, imagery, and so on. Stress inoculation is the cognitive behavioral package for reducing pain. So here's some examples. You can distract yourself, just attend away from the pain. And in that sense, incidentally, it's very different from mindfulness, which is attending to the pain. Reinterpretation. So now here it says reaching into a cooler for beer because the pain was cold pressor pain. What happens is you put your arm into ice cold water. The water is maintained just a fraction above 0 degrees. And within a minute you'll experience excruciating pain when you do this. But in the course of a minute or even a few minutes, there is no risk at all of any physiological damage being done. This is why it's a good experimental technique. Your fingers are not going to fall off. There's been no damage to the capillaries, but you will experience excruciating pain. So you're putting your hand in the ice cold water. Just reinterpret that as reaching in to get a nice beer. Contradictory imagery. Just imagine yourself lying on a beach, sunshine on you, feeling really warm. So reinterpret the coldness as warmth. Stress inoculation as hypnosis, exactly the same treatment package you're given, except people were told that a person under hypnosis is doing exactly the same. So what you'll be doing involves hypnotic pain reduction. To tell the person this is in effect a hypnotic context. Or a standard hypnosis analgesia condition, where you have a 15-minute induction, and then the suggestion given that your arm will feel like a block of wood, as if it were no longer there, you'll not feel pain anymore. Now these are the findings over the course of a minute for highly hypnotizable subjects and the lows. Now these are the pain reports, and you can see how the pain builds up even when you've been given these analgesia manipulations over the course of the minute. Now, compared to baseline, there was large pain reductions in all conditions. But I put baseline up here, that little figure. So you can see pre-treatment, the highs and the lows responding extremely similarly. Post-treatment, there's pain reduction, but in the hypnosis case, when it's a hypnotic context, the highs seem to reduce pain more than the lows. Now, that could be because the lows have a negative attitude towards hypnosis, and they say, I can't be bothered with this nonsense, or they just say, oh, this nonsense doesn't work with me, and they're not properly engaged with it. Now, if you just look at the means, well, at first hand, it looks like the hypnotic analgesia produces lower pain than the other conditions. But just due to one of the freaks of random assignment, in fact, in the pre-treatment, you can see here in the cognitive behavioural therapy, they start off, just this group of subjects start off more sensitive to pain. They're just feeling more pain as a group before treatment anyway. And if you take that baseline degree of pain into account, there's no significant difference between conditions. Now, the authors don't report whether the highly hypnotizable people are significantly different between conditions. I know it looks like they are on this graph. That line looks lower than that line. In other words, the hypnotic analgesia line for the highs looks lower than the cognitive behavioural line for the highs. But as I say, when you take into account baseline, it doesn't look like that anymore. It looks like it's pretty equivalent. And because these people came from the dissociation camp, I'm pretty convinced that if the highs did reduce pain significantly more in the hypnotic analgesia condition than stress inoculation, we would have been told that. But the test is not reported. So I conclude that there was no evidence for hypnotic analgesia being more effective for highs than stress inoculation. All three packages reduce pain considerably. But there's, as far as we can tell, we can keep the theory that there is equivalent levels of pain reduction for highs, for cognitive behavioural therapy, and for hypnotic analgesia. It's just that we can reduce pain more than we know. I mean, to a way that probably shock you if you tried these techniques. The degree of pain reduction that can be achieved simply by the way we control our minds. So why did Miller and Bowers say that hypnosis was so different from cognitive behavioural therapy? Well, the key is this, and I think this is interesting. Afterwards, subjects reported their experience and how they went about reducing pain. So was there any deliberate attempt to alter thoughts or feelings so as to reduce pain? Did you engage in some strategy like diverting attention, thinking about certain things, distracting imagery and so on? Well, in the stress inoculation package, you're told to do that. So most people said, yes, I did use deliberate strategies. In the hypnotic analgesia case, most people said, no, I didn't use any deliberate strategies. The pain just went away by itself. So, this is my conclusion. Pain reduction is about the same in hypnotic as non-hypnotic contexts. But in hypnosis, pain seems to go away by itself. And I think that's possibly the key difference. Well, at least we could have this as a hypothesis, and I'll use this next lecture as part of the theory of hypnosis, that the real difference here is just in terms of whether you experience strategy use as volitional, something you're doing, or if you're not indeed aware of using deliberate strategies. And in hypnosis case, you may be doing something strategically, but you're not aware of doing something strategically. Yes.
So from a higher order perspective, is it kind of whether the pain reduction mental event, I guess, is the subject of another sort of mental event? Is that?
That's exactly what we will come to next time. So, and to be precise about it, the intention to engage in a strategy could be conscious or unconscious because you have a higher order thought about having that intention. Now, finally, before we break, and we're talking about pain, I can show you some evidence that hypnosis is real in the sense that pain reports go with fMRI activation patterns. So Stuart Derbyshire, now at University of Singapore, took fibromyalgia patients, in other words, people who have chronic pain that's very hard to treat. And a disproportionate number of these were actually susceptible, were highly hypnotizable, and so it could be used in a hypnosis experiment. And they were asked to take a dial and to turn the dial, and as the dial turned, their pain would either increase or decrease. So they could turn the dial down to 0, to low, and that means make the pain as low as you can, the pain will go away. Or you could turn the pain up to the middle, which is just the normal amount of pain you feel, or turn it right up high, which means make the pain even more painful than you normally experience. So they're being asked to modulate the level of pain up or down, and this was either, the suggestion for this was given that the dial, you'll turn the dial up or down, either after hypnotic induction or with no hypnotic induction in counterbalanced order. So now the black here is when a hypnotic induction is given. These are all the same subjects. This is the within subjects design, or with no hypnotic induction. Now what you can see here, this is the suggestion for low pain, medium pain and high pain, that subjects can ramp the pain up and down to a considerable degree whether or not a hypnotic induction is given. And what's very interesting about that was these people were fMRI scanned. And there's a network called the pain matrix, which goes up when you cause more pain in people, the activation goes up, goes down when there's less pain. And what happens here, when people mentally turn the dial up and the pain goes up, the pain matrix has more activity, and when we turn the dial down, the pain matrix goes down.
So is the pain matrix like a neuronal circuit? Sorry,
yes, within the brain.
Yeah, okay.
Yes, so you can pick up with fMRI. And in fact, these are the areas it's spread out. So, a first conclusion I want to draw from this is the subjects aren't faking. It's not as if they're just saying high levels of pain to please you. We get parts of the brain that previous and independent evidence has said go with pain, go with the amount of pain that you induce in people, going up and down, matching verbal reports of the pain that these people say they're experiencing as you modulate it with suggestion. So that's another reason to discount the faking hypothesis. Subjects' experiences are genuine. And we can say there was a genuine difference in whether people felt hypnotized or not, and this is relevant for altered state hypotheses. So the depth of hypnosis was essentially 0 without hypnotic induction and high with a hypnotic induction. So in terms of there being an altered state of consciousness induced by the hypnotic induction, well, the only way we really have measuring that is the subject's report of being in an altered state, of being hypnotized. We had achieved differences in hypnotic depth by using an induction or no induction. Now remember I said you can get small differences in the effects of suggestion, whether you use an induction or not, and you see here a significant difference in the low levels of pain. When the people were hypnotized, they could reduce the pain just that little bit more than where there was no hypnotic induction. And indeed, increasing, it's not significant here, the bar goes up a little bit higher. So, without hypnotic induction, you get pretty huge effects, and hypnotic induction adds just a little something, a little tweak on top of that. So one question about that is that because there's a special state that's causative and important for response to suggestions, that there's a state itself that causes you to respond better to suggestions, that changes the mechanism by which suggestion operates? Or is it that the induction just changes expectations? And maybe this is the holdback effect that Spanos talked about, right? So that remains an interesting question from these data. It is important to a theory of hypnosis, because if a special state is a central part of the phenomenon, then our theory needs to take into account what that state is and come up with a mechanism by which it works. Not just say there is a state, but say how it operates. What is the mechanism? Ideally, a computational model. There's just one aspect of these data I want to comment on that you might find surprising before we move on. This is the rated degree of control subjects felt they had. I noticed in the hypnosis condition, they felt that they had more control than in the condition without hypnotic induction. So I don't know if that strikes you as slightly strange, but it's something that clinicians will tell you as well. Now what's going on here is, remember the way the task was given to subjects was to adjust the dial. Now you can imagine a mental dial in your head that as you turn it up you get more pain, as you turn it down you get less pain. What you have control over is the dial being moved. In your imagery you can turn the dial up and you can turn the dial down. Then, and this is where you experience it as involuntary, the pain goes up and down as if by itself. So all those subjects rate control over the experience. What they're controlling is their imagery of the dial. And then as a consequence of that, the bit that's involuntary that makes it hypnotic, as it were, is the pain going up or down as if by itself, just because you've turned the dial. Now, pain, the domain of pain invites another comparison that bears on theoretical issues, because there's more than one psychological way of creating analgesia, and the most common way is with placebo. Now, placebos operate via expectation. Well, there's a debate within the placebo literature where if placebo pain control is to do with conditioning or expectation, but given the role of expectation within conditioning theories, you could say that it's somewhat of a forced debate, in that when you condition people, what you're partly doing is making them expect certain things. So at least a component, and perhaps all, of placebo analgesia is expectation itself. Simply because you expect that the pain will go away because you're being treated, the pain goes away. And one of the theories of hypnosis I considered was the response expectancy theory of Kirsch. And incidentally, one should distinguish the person from the theory. So, according to response expectancy theory, hypnotic response, there's only one psychological mechanism for hypnotic response, and that's expectancy. There's nothing more to be said other than when you expect to have certain experiences, you have them. At the psychological level, that's the end of the story. There's then a physiological story to be told about how that works, but the underlying psychological mechanism is simply expectancy. That's response expectancy theory. That's not Irving Kirsch himself believes, because he believes all sorts of things can happen when you respond hypnotically. But one of his theories is response expectancy theory, and it says it's all expectancy. So how does hypnotic analgesia relate to placebo analgesia? I mean, the simple story, that beautifully nice story, is that they're the same thing. So it's beautifully nice just because it's simple. That hypnotic analgesia works because you expect the pain to go away. Placebo is about beliefs and expectations, hypnosis is about beliefs and expectations. One way of getting at this is with psychopharmacology. The simple story is placebo analgesia is mediated by endogenous opioids. And one way we know this is if you give an opioid antagonist like naloxone, you take away placebo analgesia. On the other hand, if you give naloxone to highly hypnotizables, then with the evidence that we have to date, and we're going to chase this up with further more sensitive studies, hypnotic analgesia is not reversed by naloxone. In fact, it's not touched by naloxone, to say, as far as we can tell. So it's not opioid dependent, unlike placebos. So that's theoretically very important in terms of bearing on those theories that we went through last week. I just want to alert you, the situation is not quite as simple as that, and there's some interesting facts about placebos I'll tell you about, partly because they're interesting, but just to let you know the story isn't completely simple. Not all placebos are based on endogenous opiate-like compounds. If you repeatedly give people a morphine injection, so that is opiate-based, and then you give them a saline injection, but people believe that it's the same stuff that they've been getting, you get placebo pain reduction that is reversed by naloxone. So that placebo is opioid-based. When the placebo is given in the same context, in the same way as a previous opioid-based analgesic. On the other hand, non-steroidal anti-inflammatories, that's NSAI, non-steroidal anti-inflammatories, they are compounds like aspirin, ibuprofen, naloxone. They reduce pain effectively, but they don't do it via opioids, different mechanism. Paracetamol is also good at reducing pain, but it isn't a non-steroidal. Now, see, this is an interesting case. If you repeatedly give a non-steroidal anti-inflammatory, so it's not opiate-based, inject. Now you give a saline injection. Yes, you get pain relief, so you still get placebo. But you sort of taught the body that this isn't opiate-based, this isn't opioid-based. What happens? Well, the placebo isn't opioid-based either. So not all placebos are opioid-based. If you train the body first that this is a different mechanism, actually you can kick into operation that different mechanism. So I find that kind of interesting, and that leaves the door open maybe in terms of hypnotic analgesia. But I think the simple story I gave is still a good, simple story that's not misleading, because if you simply say to people without you give them no previous experience, you just say, this is a powerful pain-relieving drug, inject them with it, that is reversed by naloxone. So non-specific placebos, where you haven't trained the body, are opioid-based. So it strikes me that if hypnotic suggestions act like placebos, they're going to be of this class, which is opioid-based. So the fact that hypnosis is not opioid-based suggests to me it's not acting like a placebo. And the response expectancy theory, well, certainly isn't a good theory of hypnotic analgesia, and if it's not a good theory of that, it's probably not a good theory of hypnosis, because if there was one case you'd really expect it to apply, it would be in the case of analgesia, right? Where we know placebos are powerful, and powerful phenomena which are highly replicable. And I like the response expectancy theory because of its beautiful elegance. So to rule that one out, I think is quite interesting. Now we can, while we're on pain, so some of you might have had the concept of altered states of consciousness as part of your diary. And one theory of what's going on, as I say, is that there's an altered state of consciousness. Because if it's not expectation, so the response expectancy theory doesn't require an altered state of consciousness. Placebos don't require an altered state of consciousness, they just require expectations. So if we rule out an expectancy theory, you might say, well, maybe there's an altered state of consciousness going on. That'll be another mechanism to explain how hypnosis works, and in particular how pain reduction works. And remember, last week we talked about the hidden observer, and there was some discussion about that because it seemed kind of odd to have two parallel streams of consciousness going on in your head. It's something that you can't imagine, because whenever you imagine a conscious state of affairs, it's from the point of view of a single perspective. It's very hard to imagine being in two simultaneous streams of consciousness. That's sort of a contradiction in terms. But nonetheless, from third-person perspective, you can imagine there being two streams of consciousness, and you can imagine them integrating afterwards. It's just that you would have memories from either stream beforehand. So it's a perfectly possible, logically possible state of affairs, and I think that would, if anything, is an altered state of consciousness. Having your mind split into two is an altered state of consciousness. And that's exactly what Hilgard said goes on during any hypnotic response, and in particular what goes on during pain control. Your mind splits into two, and there's one stream where there's no pain. So if you want to think about altered states, the part of the evidence for that is the hidden observer that we talked about last time. And then, as I mentioned, if you didn't want to believe in altered states, you might doubt that the phenomenon was quite as it seemed. So, if you're Spanish, for example, you might say, and he did say, what you have is just another suggestion. When you say to the person, now I'll put my hand on your shoulder and I'll speak to a hidden part of you that really knows everything that's going on, you're suggesting to the person that what the demand characteristics now are to, say, attend to the painful stimulus and experience the pain. Naturally, that's what you do. And then when the hand comes off the shoulder and you're no longer talking to the hidden part, the demand characteristics are you attend away from the pain, reinterpret the pain, and you experience no pain, and so that's what you report. So the hidden observer is not an essential feature of a hypnotic state, it's just another suggestion. And the way he illustrated the usefulness of that way of thinking is to tell people there was a hidden part of them that really knows what's going on. The hidden pain is more than the overt pain, that's what Hilgard had. But to say that there's a hidden part of them that is so hidden that experiences even less pain. And indeed, when he suggested that, that's what he obtained. Then when he put the hand on the shoulder and spoke to the hidden part of the person, the hidden part experienced even less pain. So the hidden observer is just another suggestion, according to Spanos, not a sign of an altered state of consciousness. Right, let's move on to other sorts of distortions of one's sense of reality or perception that can be achieved with hypnosis. So one claim by Kozlin et al., and Kozlin is one of the big figures in imagery research, was that people can see colours with hypnotic hallucination they could not see with imagination. That hypnosis added something you couldn't get from imagination. The way he showed that was to have two checkerboard patterns. One pattern was this one in fact had highly saturated bright colours, which doesn't quite come out here. So either a pattern that was very coloured or a black and white pattern. And subjects either looked at the patterns just as they were, or they changed those patterns. So when looking at the coloured pattern, they drained the colour from it to make it black and white. Or when looking at the black and white pattern, they added colour to it in their mind. In other words, hypnotically suggested that this was bright colours. Now, the colour areas of the brain lit up correspondingly. So in the case where there was actual colour and you drained it, then the fusiform area showed less activity, and where you added colour to black and white, it showed more activity. Now, part of the claim of Coslin et al. Was that if you asked people to do this in their imagination, you didn't get as strong effects. In particular, in the imagination condition, you just changed the activity in the right fusiform, not the left. Whereas with the hypnotic suggestions, you changed it in both left and right. And when you actually see the colours versus black and white, you get activity changing both left and right. So the argument was that the hypnotic suggestion acted more like real perception than like imagination. But, and this is the danger when people come into hypnosis research and they're not aware of the literature, they don't take on board the lessons that have been well established in the field. And so what he hadn't taken on board, or these authors hadn't taken on board, is the holdback effect that Spanos had documented and argued for in numerous cases. And it's clearly a concern, demand characteristics. The hypnotic suggestion, the wording of it, was subjects were told to alter their perception of the stimuli. But in the imagination condition, it wasn't the same suggestion at all. They were told to remember and visualize, and it was worded in an altogether weaker way, implying that you'd have weaker experiences. And Coslin et al. Explicitly noted that this was the case. In fact, they said they did it deliberately so that subjects would not slip into hypnosis in the non-hypnotic condition. But if you have two conditions where you say to people, create a strong effect and create a weak effect, and that's part of the demand characteristics, and you get a strong effect versus a weak effect, what does that tell you? So in this study, in which I was a collaborator, we decided to redo the experiment, but try and equalize the demand characteristics as much as possible in the hypnotic and non-hypnotic case, in part by having exactly the same suggestion given in both cases, other than having a hypnotic induction in the one case and not in the other. So subjects rated how much colour they saw, and also rated how hypnotized they were. So the issue of slipping into hypnosis can be accounted for by getting people to say how hypnotized they felt, and then we can see if they slipped into hypnosis. And we can tell them in the no hypnosis condition, please try not to slip into hypnosis. And in the hypnotized condition, make yourself as hypnotized as possible. And indeed, no participant reported slipping into trance, as it were, during the hypnosis part of the study. They just felt normal to relaxed. And they all felt hypnotized after the induction, somewhere between hypnotized and deeply hypnotized. Now, this is the percentage of color. And you see there's a graded response, but it's a pretty enormous response. So when the stimuli were actually black and white, so the colour is 0, then the percentage of the diagram that was coloured was about 70%. So that's, although it's not 100%, it's still a pretty enormous effect to see most of the stimulus as brightly coloured. Conversely, in the drain colour condition, you take a stimulus that is 100% coloured and you drain all of this colour away from it until you get to about 30% coloured. So the subjects have major changes in their perception, and you can see it didn't matter very much, in fact non-significantly as it happened, whether they were hypnotised or not hypnotised. There's an enormous effect in both cases. This study was had more subjects added to it to make it more sensitive in a later publication. And just as I reported for the Derbyshire study with pain, there what you find is an enormous effect of suggestion, and then a tiny additional effect of the induction. So it's about the same size difference as you see here, but it's become significant. So the difference here was actually a sign that there was something to pick up, that was later picked up in a more sensitive study. But what I want you to consider is, this is how much draining has gone on in both cases, and then a tiny bit more when you give a hypnotic induction. So we get back to the same issues we were talking about before. Yes, hypnotic induction seems to change things by a small amount, but why is that? Is that demand characteristics? Is it a holding back effect? Is it because we've induced a special state? Did you have a question?
Yeah, sorry, I was just getting confused about it. Are they is the y-axis the same for both the groups? So it's like 30% colour.
In a sense, there's been a 70% change for both groups. So in the drain colour condition, these are brightly coloured. The whole image is coloured. So
Yeah.
in essence, you're starting from 100%, and then we've reduced it down here.
But that seems like the non-hypnotised group has had more of a reduction in colour than the hypnotised group. Well, you said it wasn't significant, but
Actually, you're right. Yes, and I did say that the other way around. Yes, and the add colour group. So this is the way I should have illustrated it. With the add colour group, there is no colour there in reality, and we've moved all the way up here. And they've added, the hypnotised group has added more colour than the non-hypnotised group. And the way it turns out when you add up more subjects is you get that a difference of about the same magnitude here becoming significant. Yes, well spotted. So, this is a sort of recurring theme, that the induction adds a little something, but it is just a little something. And the question is, how do we explain that? In this, this was a follow-up paper where they took some people, gave them the same suggestion, and did fMRI scanning. And to say, okay, now where we make the demand characteristics more equal, what do we see? Remember in the Coslin paper, with PET scanning, they said that imagination, the no hypnosis condition, you only got a change in the right fusiform. Hypnosis produces a change in the left and right. Well, here, in this study, the left fusiform was involved without induction or induction. So when you more equalize the demand characteristics, so there'll at least be less of a holdback effect, you find left and right fusiform is involved either in the no hypnotic condition or the hypnotic condition. And as I was saying before, there is nonetheless a small residual difference you get with the hypnosis, which is significant. But what you get is a massive effect of suggestion and then a tiny additional effect when you, in addition, have the induction. And one question is, how do you explain that additional effect? Is that because of an altered state of consciousness, a fundamentally different mechanism involved, or is that just another effect of demand characteristics, of expectations, of beliefs about what's appropriate? Now here's a suggestion which I found hard to believe until we replicated it again and again and again. That relies on the Stroop effect. So as you know, in the Stroop effect, if the task is to say what colour is a word presented in, when the meaning of the word is congruent with the actual coloured ink, you're faster than a neutral case, and when they're incongruent, you're slower. Now the effect what I'm going to talk about mainly applies to the interference effect, the difference between incongruent and neutral. So I'll be talking about the Stroop interference effect. The question is, what happens when you give a hypnotic suggestion that people will not be able to read the words? So this is what Amir Raz did. He said, when I clap my hands, meaningless symbols will appear in the middle of the screen. They'll feel like characters of a foreign language that you do not know, and you'll not attempt to attribute any meaning to them. It will just be gibberish. Now, normally when you look at a word, you can't prevent yourself from reading it. So if you look at this word here, that the cursor is under, just look at it. The meaning just comes to you, and it's very hard to stop yourself from seeing the meaning of that. So the question is, what happens when we give the hypnotic suggestion that this is meaningless? Can people really stop the meaning from influencing their performance on the Stroop task? The answer is yes. So this is Stroop interference, just with no suggestion, just as it is normally. And then when you give this suggestion for meaninglessness, for word blindness, the Stroop interference effect is massively reduced. And what I found particularly convincing about this is that the baseline reaction time in the neutral case stays about where it is, and in the incongruent case, people get faster. That's what I found convincing, because in other cases of hypnosis doing things on these sorts of tasks, what you see is just all reaction times getting slower. Well, any old fool can make their reaction time slower and equalize thereby between conditions. But to make the difficult case faster, while keeping the normal case the same, that's more impressive. And that's what happens in this Raz suggestion. Yes?
I just wanted to ask, are there any other cases where participants doing the Stroop task are as good as those ones under hypnotic induction now? As in, is that the same as if you were saying a foreign language, maybe?
Now, it turns out, they used to say the Stroop was sort of like the gold standard of automaticity, in that, like, I asked you to read that word, and, well, look at that word and not taking the meaning. It was very hard to stop yourself from doing that. But there are strategies you can use that do reduce the Stroop effect. For example, you can just focus on the edge of the stimulus and one bit of it, and that will reduce it. But it turns out that and I can't remember the details of how it goes, but the patterning in terms of how that reduces it is not the same as in the suggestion case. So in fact, it's not clear. We haven't understood exactly how subjects are doing this, which is why I find this effect intriguing. You're right. You'd think there must be some strategy you can do.
Yeah, like if it was saying the colour, but in something like Japanese, where it's characters instead of words, is it similar? Because if the participants are meant to be seeing like gibberish, I mean, to most people who don't read Japanese, that would be sort of gibberish, just seeing the same.
Are these English people looking at
English
Japanese?
people looking at Japanese.
And it's Japanese words. Well, then, if you don't speak Japanese, then you don't get a
similar effect to that.
Well, yeah, well, yes, in a sense you wouldn't get a Stroop effect if you can't read the words. That's right. The other thing you could do is blur your eyes. Just go out of focus so you can't read the words anyway. Raz has addressed that by giving drugs to the eyes to stop people being able to control them, focusing the images so that they're sharp, and then he still gets the effect, even though you can no longer control the muscles of the eyes to change your accommodation and get the blurring. So it's an intriguing result, not one that I anticipated, in that the normal rule with hypnosis is you can't do anything as a hypnotic suggestion you couldn't do otherwise. And here, people are doing something that looks remarkable. But here's a further factor to take into account. If you repeat without a hypnotic induction, you get the same degree of reduction in Stroop in Stroop interference as with an induction. So the induction is not necessary. In ties only, yes. And indeed, as I'll show in the next lecture, lows don't do this. They don't get this reduction. So I'll leave that for now, but one thing to bear in mind in terms of an altered state theory is the induction. Well, it was non-significantly different in this case, and as I say, the normal rule is that an induction does change things by a small amount, and this is a non-significant difference, so it doesn't mean anything in itself. But one thing we can say is there is a significant and large reduction in the no hypnosis case. So my speculation would be is if you ran lots of subjects, you get the suggestion doing a lot, and then the induction adding a little bit. That would be my guess. But at least we can say we don't need the hypnotic induction to do a lot. The suggestion works fine, even with no hypnotic induction. So what is the role of an altered state of consciousness in hypnotic response? First of all, let's be clear what we mean by it. We mean some global change in how the mind works. An example of a global change is go down to Falmouth Bar and get drunk. Right. Clearly, there's a global change in how you process information, the way you attend, the way memory works, the way you perceive things. There's lots of changes happening. So there's no doubt altered states of consciousness exist. They change how you process information. But is the hypnotic induction a specific way of achieving an altered state of consciousness? And is that, if it is that altered state something that has causal powers that facilitates response to suggestion? Well, here's a really interesting experiment, partly because of its simplicity. So David Oakley, before he retired, used to run a very active hypnosis lab at UCL in London. And what they did here was to take a normal hypnosis induction, but take out all reference to hypnosis and just substitute, whenever the word hypnosis occurred, substitute it with relaxation. So it's exactly the same induction, except you're just not calling it hypnotic. You're saying you're becoming more and more relaxed rather than more and more hypnotized throughout. So then subjects are given a set of suggestions. They rate on a 1 to 5 scale how much they responded, from not at all to a great degree. And they're either just tested twice, or with a standard hypnotic induction, or with the same induction but just labelled differently. And what you see is all you have to do is call it hypnosis, and that's when you get this small but significant change in degree of response. A bit less than 1 unit on this 1 to 5 scale on average in response to each suggestion. The thing that was important was it was called hypnosis, because you're doing the same things in terms of relaxing people, directing their attention, engaging imagery, whatever else you might think is important in inducing an altered state. But it turns out what's important is you just call it hypnosis. And that's incidentally a more general conclusion. If you look at the lecture on altered state I gave that are put up on the course website for the Contemporary Issues course, you go through a number of inductions, and there's no set procedure you need to go through. Kind of people pedaling on a stationary bike. You can be doing funny things that clinicians say, like babbling in one ear while giving other suggestions in another ear to confuse the conscious mind and so on. it doesn't matter what you do. You can give people a pill that's labelled hypnosis. As long as they believe it's a hypnotic induction, it's as good as a hypnotic induction. It is a hypnotic induction. So the procedure itself is not important. Nonetheless, that doesn't mean that a hypnotic induction doesn't induce an altered state. It may well be that highly hypnotizable people are the sort of people who can induce in themselves an altered state, and they just have to know that this is the right context for it to happen. So as long as you tell them this is a hypnotic context, they say, right, I'm going into my state now, and that's it, they create the altered state. So is there any evidence for a change in the way the brain is working as a whole, information processing as a whole, that we could say is a marker of a hypnotic state? The short answer to that is no. In particular, there's no EEG markers, ERP markers, biochemical markers. There's nothing that stood the test of time in terms of being able to be replicated that has picked out a hypnotic state. But you could say, historically, we had fairly blunt tools. Nowadays, we have a lot of fMRI and brain scanning. Maybe now we can pick up on things that we couldn't pick up on before. And indeed, there's now a number of fMRI studies. I'm going to go through one that says there's a change in default mode activity that occurs after a hypnotic induction. So I want to go through the evidence for that. So these are the subjects that went through the hallucination study that I was talking about, where you see the checkerboard and you have to add colour or drain colour from it. But in a separate paper, what they said, why don't we look at the induction and no induction trials, but we can just look at the case where the subjects are looking at the fixation cross ready for a trial. Nothing else is going on. So this is a pretty neutral state of affairs, and the only difference is the induction versus the no induction. And we can see if there's any difference going on in the brain, as revealed by fMRI, that might mark a difference in state. So that's what it means by rest here. Passive is when they're looking at the checkerboard patterns, but nothing's been suggested to do with them. You're not draining colour, you're not adding colour, you're just looking at them. And active is when you're draining or adding colour. You're actually doing something hypnotically. Some hypnotic suggestion is in play. I don't know if you've heard of the default mode network. Does that mean anything to you? You can laterally divide, sort of divide the brain up into lateral parts and medial parts, which means inside it. The lateral parts come into play when you're attending to the world, and the medial inside bits, all the way from the front to the back, tend to be active when the person hasn't been asked to do any task in particular. That's why it's called the default mode, or default mode activity is what's going on then. The person isn't being asked to do anything in particular, yet the brain is still whirring and ticking over. Well, this default mode activity for highly hypnotizable people, which is the filled-in bars here, has been reduced in the rest condition for hypnotic induction versus no hypnotic induction. So given the hypnotic induction is associated with a reduction in default mode activity, and specifically for the highs, which is what you want, because you don't want it for the lows, because the lows apparently don't experience this altered state. So what do people think of that? Does that show, is that a possible altered state marker?
Yeah, it seems that way. But I don't know, how much of it is an altered state, as in maybe it's like a spectrum of like, it'll go very smoothly from, or maybe there's no like line where it's like, this is now the altered state, that's hypnosis.
Yes.
And before it was not.
Yes.
Do they get similar effects when they do things like, if you did this with drunk people again, and things like that. Different altered states that you can induce.
You do get it with meditation. So when people meditate, there's reduction in default mode activity. I don't know about being drunk. Good question. So I have it here. The reduced activity in default mode network, that's DMN, in meditation. So what is the default mode network doing? Well, it's probably involved when you're daydreaming, remembering things, planning things, reflecting on yourself. But is that really an altered state of consciousness when you have a reduction in default mode activity? Because maybe what the highs are doing. So your default mode network goes down in activity just by attending to a task. So the fact that the default mode has gone down doesn't seem to me to be any special altered state of consciousness. It might just mean you're focusing your mind on something in particular. Maybe, for example, waiting for the suggestion from the hypnotist. Or preparing your mind for the hypnotic suggestion that you're about to respond to. In other words, you're just focused on the task. Whereas what the lows are doing, they're daydreaming. They couldn't care less about this silly nonsense. But it could be as simple as that. The other thing I want you to notice is when they're responding to a hypnotic suggestion, this difference isn't here anymore. So remember, this is the active is the suggestion condition. There is no difference between hypnotic and non-hypnotic. So this is a funny sort of altered state if it goes away just when you're responding to a hypnotic suggestion. So, I think actually what this is pointing out to is not to a state that's causal or facilitative in responding to suggestion. Not that, because it goes away when you are responding to a suggestion. So this isn't the sort of state that could figure in a theory about how you respond to suggestions. On the other hand, we could think of, subjects say when you give them hypnotic induction, highly hypnotizable people respond to all sorts of experiences, they describe all sorts of experiences that they're having. Time will go slower by and large, they feel inwardly absorbed, the mind is stiller and so on. But maybe the induction is in effect just another suggestion. It's the suggestion you'll have funny experiences. So now, highly hypnotizable people are the sort of people who can create experiences within themselves. So when they understand that, now's the time to create an experience of whatever they think the experience is, that's their understanding of it, they create it, because that's the sort of people they are. They'll oblige the hypnotist and create experiences in themselves as required. Now that theory would fit, I think, because when there's no other suggestion going on, you can concentrate on the altered state suggestion. So you calm your mind, you don't daydream, you still it, and maybe just focus on the hypnotist, because that's what you understand the task is, and so that's what you get. But now you have another task of adding and draining colour. You can turn your attention away from the altered state suggestion, and you focus on this other suggestion, which is changing colour. So on this theory, yes, there is an altered state, but it's something created by the highly hypnotizable person because it's suggested, and is not in any way required or facilitatory of response to any other suggestion. But I should say that is my conclusion, just because I think it's a simple conclusion. But there's not a consensus in the field about the nature of the altered state. Clinicians in particular are fond of the theory there is an altered state that enables you to do powerful things. And it's a good theory to have as a clinician, because the more you can pump expectations in the client and make them believe you're dealing with something extremely powerful, the better the therapeutic effect. So it's in your interest as a clinician to believe in the special power of the tools at your disposal. Amongst academics, there are those who think there is something to special state, that's more than I said, and there are others on the other side who say it's just another suggestion. I would say until a mechanism has been put forward, we don't actually have a theory on the table to discuss. And so the simplest theory is it's just another suggestion, and I think that is strongly supported by these data here. And if people who believe in the altered state as being causal, of course they should pursue that. But what we need is a mechanism that says how the altered state works, so we have something to test and to falsify. So these are the conclusions we're going to take forward and that we want to explain next week. So first of all, the most important one to start with is highly hypnotizable subjects are not faking. They have subjectively compelling distortions of volition and sense of reality. There is something really interesting here to explain that tells us something about the nature of consciousness. However, the experiences are contextually appropriate, consistent with the subject's general goals. The person hasn't become some sort of zombie or robot. They hypnotically do things that further their own interests. And subjects can resist a suggestion so long as they believe they can or are motivated to do so. I think this deserves more sensitive experimentation to see just how far this can be pushed. And also, I think a very important conclusion we know is hypnotic response, even to difficult suggestions like analgesia or hallucination, including the RAS suggestion of overcoming the Stroop Effect, does not depend on a previous hypnotic induction. People don't even have to feel hypnotized to get almost all of the effect of a hypnotic induction, a hypnotic suggestion, if not all of it. So the main thing to explain, I conclude, is how do people respond to hypnotic suggestion, not the nature of hypnosis as a trance or altered state of consciousness. Because if the hypnotic trance exists, it exists in the sense that people experience an altered state, but if it exists in the sense of something that has causal powers, it does so only to a small extent. So it's not the main thing to explain. And a good start, I think, for a theory of hypnosis is to explain how do people respond hypnotically and leave the altered state issue to one side.